Hi people, hi my friends. Mko aje? Melala poa? I know right now you're in a very busy situation or you're in school getting ready to go to work. All those stuff. So, your girl is back again. Yesterday I promised you a video of me as working in prison as a nurse. So, I'll just go straight to the point. Uh, So we do admissions. We do admissions for these prisoners. Like the way you do an admission in hospital, you have to open a file and make sure that they have everything. So, well, of course, they start from police. The police arrest them, and then they are taken to the police cell, and then from there, the police transfer them to jail or prison. So this is mostly in the evening, and then from there the interviews are taken by, we call them the DCS officers. I don't know, most people maybe out there they call them guards, but ukimwita guard na kuangalia vibaya. So yeah, so we are trained to call them DCS officers. They are Directory Correctional Services officers. So wako na jina, and their pay is good as well. So yeah, so anyways, so after that the DCS officers, like I said, they take interviews, and then from there and then after interviews they are settled, like they take their shower, they have to have a shower, change into prison clothes, and they are given dinner. So from there, a prisoner, even if it's 8 o'clock or what time, a prisoner cannot go to bed before seeing a nurse. Why? It's very essential, it's very critical. They have to do a thorough assessment, what we call a comprehensive nursing assessment or a comprehensive assessment. This is assessing head to toe. That is making sure this person, do they have injuries? Some people come with assaults, maybe they were fighting and they ended up in jail. So you have to assess whether this patient is okay or prisoner is okay. If they've got a wound, you have to dress that wound. If they got even an old wound that is not healed, you have to come up with a care plan, a wound care plan. How often are you going to be doing that wound? So you have to, another vital information or what you're supposed to do is taking vital observations. So you have to check a blood pressure, you have to check their temperature, their saturations, their pulse rate, respirations. And if there is something wrong, my friend, you have to ring an on-call doctor is standby, because you have to do something. If the doctor is not there, maybe it's past hours, past working hours, you have to organize to transfer that prisoner or patient, we call them patient, to hospital. So after that you have to, there is this paperwork you have to fill in, their past medical history, mental health. I told you that is very common with people who've been in prison or who are arrested, because they of course they have a mental breakdown. There's something that has happened, or they have post PTSD, post traumatic syndrome disorders. They have anxiety disorders, they have ADHD. A lot of issues come with those people who are in crime or whatever the case. And then after that, from there, and you have to also make sure if this person has a pet, remember this is a foreign land. They really um, take pets seriously. So you have to make sure they have someone back home that is taking. You have to ask, do you have a pet? Do you have kids? Who is taking care of them? You know, do you know watu wakishikwa wapelekwe kwa jera, they hawananga ni jera ama ni jela. Someone, I mean R's and L's, whether it's in English, whether it's in my language, zinaletanga shida. But what I wanted to say, if you are arrested and taken to prison or police cell, there is no time that you're told to just go and say bye to your family, just bid goodbye to your kids. No, so you have to make sure the police arrest you wherever they get you. It doesn't matter if it's a crime, it's a crime, so you get arrested. So you have to make sure this person have what they have, that everything is taken care of. So that's why maybe if someone is worried about their kids, if they were taking care of their mother, father, their family members back at home, someone might come and say, I was the carer for my mom, I've been looking after my mom, and now she's back home. So you have to contact social worker. So here, that's where social worker comes. You have to contact them and make sure that they reach out to the family, and the family can get the best help possible. So, and then if it's a pet, you have to organize how is it gonna be for that pet. So it's that serious. So, and then if someone have past medical history, you have to follow up with their medication. If someone is very ill, so what happens, we don't have wherever I work, but some other prisons, they have wards, but wherever I work we don't have wards. So if someone is really needs medical attention, like a very serious one, well, like maybe ICU, or someone is like very sick, bleeding, they're bleeding profusely, they have to go to hospital, and hospital is just nearby. So you call an ambulance, and then from there they are taken to the hospital. If it's an emergency, from there they are escorted to hospital, and either if it's not very urgent, they can be transported to hospital by prison vans. Anyway, so that's the if someone is alright, that's the admission process. If someone is okay and you are satisfied they are fine, and maybe you find they have they are worried, they are anxious, it's their first time in prison, so you have to organize to how often would you like to see this person. So you go and book them. If you want them to be seen tomorrow, it's your responsibility as a nurse, it's a duty of care to follow up, to make sure this person is good, to make sure this person doesn't go into those cells and maybe kill themselves, or maybe they harm others because they are anxious, or if they are it's first time in prison, they can barely sleep. So what do? You give a tablet to help that person sleep. It sounds unreal, guys, right? And I am maybe thinking, oh, this is person who's made a crime, or who's committed a crime, that's the word, out there, and doesn't deserve all these good things. No. So you have to do something. It's not your business, whatever the crime they did, as long as they are there in prison. It's a duty of care for you as a nurse to attend to that patient. So So you try to make them as comfortable as they can. And then mental health, I said it's a big thing, and this is where you have someone threatening to kill themselves because they feel like they've lost it all. Oh, I had my business and now my business is gonna go down, or who's gonna take care of my kids, I've failed my family. So, and also the people, maybe they had other commitments out there, and they feel like they have brought shame to the family and they don't deserve to be alive anymore. So you have to escalate the care. They don't just go to a normal prison. No, they have to go to a management prison where they are observed 24 hours via CCTV cameras. So yeah, and that has to be put in a paper, and communication has to go around the whole prison to the DCS officers, and they have to watch that person overnight and make sure that person is okay. Because I told you that the worst thing that can happen is a prisoner dying in a cell. Oh my god, you have to go to court and explain what happened. So and then in the continuation, so if you're worried about someone during admission and you organize the day you're gonna see them, maybe tomorrow, mostly for those who have those mental health issues, threatening to kill themselves, you have to see them tomorrow or every day until you're sure they are okay. And also you have to organize for medications and to settle them down, especially if someone has a medical history of mental health, whether it's anxiety or depression. And also you as a team leader, sometimes there is someone who plays a role as a team leader, and you have to find out from the other hospital that is on the system. You have to find out whether this person has ever had any issues before and what treatment were they using before. And then from there you have to follow up. You, even if it's in a different country or state, you have to ring them and send we call it a request of information. You send them ROI, and then you send them to send you medical records, summary of medications and all that, and then they send it to you. So it's like a continuation thing, like you have to make sure everything is going well. So and then from there, so you every day, so there are maybe 1,000 prisoners, depends where you're working, and of course you're scheduled to work in a certain area every day, because of course you can be everywhere. So you're scheduled to work in a certain unit. So the day-to-day lives is there are those prisoners who are on medication, daily or regular medication. Maybe they have heart issues, they have high blood pressure, high blood sugars, they use insulin, all these things, all these common, like it's a human being, so we expect all these things to be there with people, even if it's prisoners. So every day, so if you're scheduled to go in a certain, so you go to work, you clock in, and then from there you go in the morning, you administer medications, and then you have to see others in the clinic. Maybe if someone was booked, like the one you saw yesterday, you admitted yesterday, if he was booked to be for mental health review, so that's what you do. You find out how they are traveling, and then you give medication if necessary. If you want to refer someone to the doctor, we have also doctors on site. We have one doctor on site and another nurse practitioner on site. So nurse practitioner is someone maybe who studied after you finish your bachelor's in nursing, you maybe study, I think, 4 to 5 years. Yes, it's close to a doctor. So nurse practitioner, what they do, they can prescribe medication. Yeah, but nurse are just, even if you've done bachelor's, you can't prescribe medication. So for nurse practitioner, you can prescribe medication, you can diagnose, all those stuff, but they are restricted because they can't do everything. Sorry guys, someone is texting me, and I'm sorry. So from there, and then so you review these people during when you're scheduled to go to that unit. After medication round, you go to a clinic and you sit down with them, you listen to them. If it was a wound, you dress the wound, and also schedule when you want it to be seen again. If someone they got a lot of complaints, because we are not dealing with someone who's been admitted like yesterday only. We are dealing with someone who's been there like 30 years ago, because some others are like there for life sentence, you can imagine. So I want you to have that in mind. So you're seeing people who came in different times. Is someone who's been there for almost 30 years. Even if it's not one prison, they've been moving around. So this person has been in prison for a longer time. Those who are in life sentence. So they've got a lot of issues. They have also this loneliness. Someone also has maybe increased their weight, and they're now having issues with their mobility. We have even older prisoners with 80 years, 90 years. So this person who has mobility issues, walking problem, they even walk with walking aids like a walker, like a wheelchair. Some has disabilities. So there's a lot to do every day, a lot. So because someone is saying there's somewhere they put their complaints. It's like a machine. It's called Kex. I don't know what the full name of that. It's just known Kex. It's just a system where they type in their problems, and someone on the health side, a nurse, receive their the review, and they're able to schedule also for clinics when they can be seen depending with the priority. Nursing is all about prioritizing. If someone has a very needy issue, or you feel it's more urgent, for instance, if someone is having a tooth infection, and that's a big problem in prison. You guys, I told you, please come down here in the comments. If you work in prison or in a same setup like this, please tell me what are the main issues that you see in those areas. Because for me, where I work, most prisoners, they have tooth issues. Oh my god, because they eat everything, and maybe the oral hygiene is not good. And so you have to see someone has maybe a tooth infection. You have to act promptly as a nurse. You have to call a doctor to give that person to give the patient, this is a patient now, infection, to give that patient antibiotics. If you don't have a doctor on site that day, maybe it's after hours, you have to call an on-call doctor, and then you have to book that person in urgent dental list. Dentist list. So we also have dentists on site that they come and see these patients every day. Not every day, maybe twice in a week. But if a patient has a tooth infection, because you know what that can do? Any infection in body, you have to be very careful with it. It can cause sepsis, and sepsis that's another one we're gonna talk it's very dangerous. It's in blood. Yeah, it's in blood. It's a infection of blood. It just makes everything worse, and someone can die. It has happened. I've had other stories. Someone had a tooth infection and it was not taken seriously, or someone didn't say. That's another thing. And be a prisoner, he's intimidated, he's even a foreigner or someone who's not talkative, or they don't know who to go to, so they get this maybe problem. So he had that tooth infection, and they never told any nurse, or they didn't put a complaint on that cake's request. I'm saying, so no one knew. So, and then he had sepsis and he died actually, and that was a case. So you have to, if you see a prisoner and write a note and something happens to them, because of course you have to write a note every time you work with those files. You work with the files and write a note. So if in case you didn't do a good comprehensive assessment and something goes amiss, and maybe a patient goes to hospital and dies, you are answerable. Like if something is not clear, how did this happen, how did he die that quick, that fast? So you have to be very, very careful with what you are doing. That happens everywhere. Nurses, you have to be careful. Even if you are working in hospital, you have to be very careful what you are doing and what you are the nurses skills. It's very important. That's why we need also to update our skills every time, and that's why we're here to learn and know. We also learn from mistakes. I'll tell you another story, guys, that happened today. And as I was working in hospital, because sometimes I work in hospital as well, and I'll tell you, guys, documentation is very key for a nurse, and it saves you a lot from a mess or any signs that patient is deteriorating. Guys, you have to take it seriously. But yeah, that's a story I'll give you later. Let me finish with this, what I do in prison as a nurse. So yeah, so after seeing them so you see them for many reasons in those clinics. So maybe someone has high blood pressure, you have to review the blood pressure, and also you also book them for the doctor and refer them to the physio if someone has maybe back pains. So I told you, like I said, we have these elderly ones, and they have issues. Maybe someone has been there for long, they have increased weight, and then they have these issues with their pain, and yeah. So, and then we have emergencies, guys. That's another thing. You have emergencies that maybe someone was playing football outside, and that's a prisoner, and they tend to fall. So and then they get an injury. What happened? The officers, the guards, I'll just call them the officers, the way we call them. They call a cord black. So we have cords here. It's like I can't remember in Kenya what we used to call it. An emergency. Someone can please comment down here if it's an emergency in hospital. I don't know. I can't remember whether it has a name in Kenya. So if you're there and you work in MTRH, I used to work in MTRH, not to work, sorry, as a student placement. I know, guys, that's where you go if you are in Eldoret, MTC, and wherever you are. So we used to have here we have cords. We have cords everywhere. We have in hospital, if it's an emergency, we have a cord blue. We call it a cord blue, but in prison it's called a cord black. So if that prisoner was playing and had a fall and have an injury, So they call a cord black immediately, because of course they are being watched while they are playing, while they are doing other activities outside. So and then there is a team allocated for a cord black every day. So that includes the team leader and 2 other people. And so you push, there's a trolley you push. It has got everything, has got oxygen, has got, you know, everything you can think of that is an emergency kit. Has medication for first aid medications, has everything you can think of. So and the wheelchairs, another one carries a wheelchair, and another nurse carries is a scribe nurse. So you have to write down immediately what happens with the prisoner. On arrival, we arrived at this time, prisoner was on the floor, oh, he was having difficulties in breathing, so I'm giving another situation. Maybe the prisoner was having chest pain, for instance, another, and they were gasping of air. What's the GCS score? Is it are they responding? Are their eyes opening spontaneously? Are they responding to are they following commands? I mean, you have to do all this assessment. Check pain score. Do you guys know we have pain score? Pain score 10 being the highest and 0 being the lowest. Someone may be talking and they know their pain score. I'll tell you stories. You've responded to a maybe very bad code. You don't know what to do. Someone is having seizures. Oh my god, it's a very stressful situation, but when you get used to nasikianga guy mi nitapotea you know, and you're there to save a life, and maybe you're the team leader. You have to be guarded, like to have skills, huh? You have skills, you know what you need to do in an emergency. And this is another thing I'm gonna cover here, because anyway, it doesn't the confidence, it doesn't just come one day. Maybe you are new somewhere and you're called for a cord black, and you are like, oh my god, what am I supposed to do when someone is unconscious and their eyes are all wide open, and you're in that situation, and if something goes wrong, they have to write. If something goes wrong, you're gonna say what you did. And also we're gonna learn what you're supposed to do if someone has chest pain, because chest pain can cause stroke. You have to learn signs of stroke, guys, which is I think I'm gonna cover this tomorrow, because I have a student who was saying, oh, the diabetes topic was very good, she could have scored everything, and she wanted me to cover stroke, so that's a good one. And guys, listen to stroke if you're a student there. And sometimes it's hard when you are starting to get these things, but when you go out there on the ground, you know these things better. So let's, and we also have mastered some maybe words to use and be able to remember the signs and symptoms you look for. And it's also good to hear from other countries. So like in Australia, what is the stroke protocol? What is the chest pain protocol? So tune in. Tomorrow I'm gonna do a video for stroke, what you're supposed to tell. So those are the things. So responding to emergencies, so you have to get that person, to wheel that person, not to walk. Even if he's a prisoner, you wheel them with a wheelchair, push them. You can't allow a person who has got chest pain to walk. If it was a stroke that was coming, my people, they're gonna collapse and die. Another thing, you don't allow a person who's got a patient who's got chest pain to do, guys, ask me, don't allow them to go to the toilet. That's another thing. Never allow. Give them a bedpan, give them a wee bottle. Wee, they call wee. I told you wazungu wanaongeanga na slang. We ni urine. It's not our English word, but even if you Google, I think you might find it. But so give them a urine bottle to do it from their bed. You don't allow someone who's got signs and symptoms of stroke to, even if you're not sure, please don't. So let me give you an example of if you responded to an emergency for a prisoner who has chest pains, because this happens a lot. Oh my god, it happens a lot. Some are unreal, because maybe someone is in a unit that they don't want to stay, and they know if they say if they got chest pain, it's taken very seriously. A cord is called and they are taken care of, attention is on them. So you can imagine how many cords you can have in a day. If maybe they have been, if someone is not feeling alright, someone is being maybe mistreated in one unit by fellow prisoners, these things happen. And they feel like, oh, they don't want to be there, or someone is just want attention, they just fake. But even if it's fake, how are you gonna know it's fake? They all know all the signs and symptoms of stroke. They're gonna come and tell you, oh, I've got a pain that is, they'll tell you the highest pain possible. I told you, pain is 0 to 10, so the highest is 10. The prisoner gonna come and tell you, I've got a pain sitting on my chest. That means constant. It's there. It's not going anywhere. Sitting on my chest, 9 out of 10. That's a pain score, and it's radiating to my left arm and to the left shoulder. Oh my god, that's signs of stroke. I've told you already, guys. So you're like, oh, so the first thing you do, even if they don't even explain all that, if someone says it's a chest pain, you have to bring them to the unit, to the main health center, where it's like a nursing station. You do an ECG, guys. You have to learn to do an ECG. Don't wait for the doctors to come and do an ECG for you. Well, I know protocols are different, but what if you've got a very ill patient? So anyway, I know some of these things you're not even maybe able to access, but if you're able to access wherever you are working as a nurse, please do an ECG. And also, I'm talking to also family or carers, family members of these patients. So you're also learning what to do to a person or patient saying they've got chest pain. Those are the signs of stroke. So they have to do an ECG check to check their heart, and then from there